Melissa with Medical English Melissa, and this is Medical English 5-Minute Clinic. So in the next 5 minutes, I'm going to try to give you as much information as I can about a medical English topic, and today we are talking about family history. So I'll go through some of the most common phrases that I think you need to know that might not come naturally to you if English isn't your first language, and I'm also going to talk about mistakes that I see students make most often and the correct ways to say them. I'm going to go through the phrases that you absolutely need first, even if you might already know this. So the first thing you want to know how to say is just, has anyone in your family ever had, or has anyone in your family ever been diagnosed with? Has anyone in your family ever experienced? And these are all different phrases that you can use to ask most of your questions. So, has anyone in your family ever been diagnosed with diabetes? Has anyone in your family ever had a heart attack? Right? These are examples of how you would say it. There are, of course, a bunch of follow-up questions that you'll want to ask because in every language, patients don't know what's medically relevant and what's not, and so they might make a little comment. Oh, I think my grandma had some sort of heart problem, right? And you'll have to ask a lot more, but there isn't time to do that in this video. If you do want time to do that, I have a medical English course that I'll be launching soon, and you can sign up for the waitlist in the link below. Let's get into common mistakes that I see. So this might seem obvious, but it's not. Family and history, both of these, almost always they stay in the singular. So you don't ask about someone's families. When you want to ask about someone's family, you can ask about members of their family or relatives in their family. But family stays singular. And the other one is history almost always stays singular, which is going to lead to my next one, which is strong and weak. Instead of saying the patient has many family histories of, you would say, the patient has a strong family history of. Okay, a really helpful verb when you're talking about family history is to run, because we say that something runs in someone's family. So a patient might say hypertension. Okay, maybe a patient wouldn't say hypertension. They're more likely to say high blood pressure runs in my family. My grandma has it, both my mom and my dad have it, and my sister has it, right? So it runs in my family. Another term that's going to be super helpful when you're asking about history is mom's side and dad's side. So when you talk about something being from one side of the family or the other, that's, like I said, give it away because that's the only way I know how to say it. That's the word you're going to use, side. So mom's side, which would be maternal, right? That'd be the medical word that we use. Or dad's side, that would be paternal. Did I just switch these? I might have. Okay. So if we're talking to someone who's medically knowledgeable, we might say, oh, his paternal grandmother had a stroke. But if we're talking to a patient, they're more likely to say, my grandma on my mom's side. So depending on what your native language is, this may or may not come naturally to you to say. So mom's side, dad's side. We say immediate family when we're talking about someone who is at least half genetically related to you. Did I say that right? They have like half your genetic makeup. So mom, dad, siblings, and siblings is brothers or sisters, right? And everyone else we'll call relatives. Another helpful phrase to know is genetic predisposition. So if diabetes runs in someone's family, the patient might have a genetic predisposition for diabetes. This also brings me to another really important thing, and this is, to me, this is like a really big mistake that you don't want to make. You don't want to say real parent or real parents. And you can actually really hurt someone's feelings if you do this, because just because someone isn't genetically related to them, it doesn't mean that they don't consider that person their real mom or dad. And so you want to avoid saying that and instead say biological. So you can ask questions about someone's biological mom or biological dad or biological relatives. Another phrase that you might hear used is family tree. I actually polled my Instagram followers, and it turns out that this works in almost all the languages, which I think is really cool. But we talk about a family tree, And you don't need to use it when you're taking a history, but a patient might say, oh, we have a lot of alcoholics in our family tree. It runs in the family. And another phrase that is not medical history, but you're going to hear, and so I think it's helpful to know what it means, is to die of natural causes. So this isn't a medical term, and this isn't a medical diagnosis. It just means to not die of like an accident or a homicide or suicide. It means that you died of some sort of natural event, but it doesn't tell you specifically like what sort of natural event. So any medical cause of death that's just like a disease process is considered a natural event. So if a patient says, oh, she died of natural causes or she died of old age, that's another one that you'll hear, you're going to need to ask more questions. Now, someone might say that they don't know. They don't know one of their biological parents, or they don't know either of their biological parents, or they might know them, but not, or know of them, but not know the history. I would say something like, that's all right, or no worries, no problem. It's helpful for us to know, but we can still take care of you, or we can still do your visit, or we can still address this problem without that information. Because we really don't actually need to know. It's nice to know, but we don't need to know. We can still do our job without it. And that's all I have time for today. Let me know in the comments what you want the next video to be on. And in the meantime, you can find me in all of these places. And of course, you can find me on my website, which there's a link to it below, if you want to sign up for the waitlist for a medical English course, or if you want to just ask me a question or do private tutoring with me. And I will see you in the next episode of Medical English 5-Minute Clinic. Bye, guys.